With the fallout from the pandemic and an older population that needs more healthcare, there is a broad consensus that things need to change in Canada's healthcare system. In Ottawa, we're working on a transformative healthcare project, the construction of a new hospital campus. Today, we're not going to talk about the building, we're going to talk about the innovation and technology solutions that will have an equally large impact on patient care and outcomes. If you're a local tech entrepreneur, the Ottawa Hospital's door is wide open when it comes to innovation. Get all the details on this episode of Techopia Live. Hello, everyone. I'm Michael Curran from the Ottawa Business Journal. Welcome to Techopia Live. This is a special episode of the show that's related to an upcoming report from Techopia and EY on the state of the local technology sector. And often when we think of the tech sector, companies such as Shopify and Kinaxis, Calian, Ross Video, and many others come to mind. We don't often discuss the technology and innovation that is related to the delivery of public services. And as we learned over the past couple of years, there's perhaps no bigger or more important public service than healthcare. Here in Ottawa, there is a once-in-a-generation project happening right now that promises to transform the city when it comes to healthcare. It's the new campus of the Ottawa Hospital that represents an estimated $2.8 billion investment. The Ottawa Hospital aims to be the most technologically advanced in the country, driving industry-leading research and providing the most sophisticated clinical care to every patient. Today, we talk about the technology and innovation play in healthcare right here in Ottawa. To talk about this transformational project and what's happening right now in terms of innovation and its impact on the city, I have a special co-host today. He is EY's Canada Partner for Public Sector and Healthcare Consulting. Earlier in his career, he was the Program Director of Innovation at Sick Kids Hospital. He brings a wealth of experience, and he's the perfect co-host for me here today. Please welcome Aaron Smith. Hello, Aaron.
Hey, Michael. Thanks for having me.
I'm excited to have someone with your, as I said, wealth of experience here to explore this topic. So excited to dig in. So let me introduce our guest here. He's the perfect person to be with us today. He is the Executive Vice President, Chief Innovation Quality Officer at Ottawa Hospital. Over the course of his career, he has led research on patient safety and quality improvement. He has also led the Ottawa Hospital's data strategy, which is being used to support research, operations, and planning. His work has led to more than 240 publications in peer-reviewed journals and innumerable advances in quality of healthcare. We're pleased to have with us here today, Dr. Alan Forster. Welcome, Doctor.
Thanks, Michael. It's nice to see you, and nice to see you too, Aaron.
Alan.
So, Aaron, with all your experience, we're going to let you take the lead in terms of asking the questions today. So let's get right to it. Take over here.
Excellent. Alan, thanks again for joining us today. So quality, innovation, data, those are massive topics. So maybe just put your role into some terms that the viewers could understand. And interestingly for me, how do you define innovation at TOH?
Yeah, great. So, I've been working at the hospital for many, many years. Started as a medical student here. So have seen a lot of different aspects of care. Ultimately, what my job is to help our providers, help our staff, help our physicians deliver excellent healthcare to our patients. And my job is one in which we have a department of quality, we have a department of innovation, we have a department of analytics, and those three groups work very closely together to help our providers, help our leaders identify what the issues are that are getting in the way of excellent care, but then also working with them to overcome those barriers. And so that's really been my role for many years, and it's one that's very exciting because right now, as you said, as Michael mentioned, we're at this cusp of a change in how of the physical environment where we're working. My role in innovation is relatively new. Innovation itself for us means taking new discoveries, bringing those into practice, and then demonstrating an improvement in outcomes, whether that be better patient outcomes, better staff outcomes, or lower costs. So really that value equation where you have outcomes divided by cost is really what we're driving towards. And that again, that's from the patient perspective is really the key focus there.
Excellent. Excellent. So knowing that the role is new, I think you've had already a tremendous impact, and it's going to be even more impactful as you think about the growth and expansion of the hospital and the campus. So maybe help us understand. Overall, you're trying to drive impact, but what's the vision for innovation, and how have you been able to make sure that the hospital's incorporating it as a strategic driver and not just something that's aspirational?
Right. So ultimately, there's a lot of different aspects to innovation, and I would just say healthcare has been a bit behind in terms of other industries in terms of how innovation is encouraged. And so we've really been taking we started at a high level with what are our goals, but then moving it down to say what's getting in the way of this sort of challenge that we have in healthcare as a general concept. And I would say there's a number of things that we've done that are unique to Ottawa within the Canadian context, but ones which I think will make a big difference. So the first is we've recognized that in order for innovation to happen, there needs to be a stronger position by which we work with entities outside of the hospital, whether that be universities or private sector companies or others. There is a need for us to bring in those great ideas from elsewhere. To be perfectly blunt, that has been a problem in healthcare for many years, especially in Canada, where we have a very government-focused and sort of top-down approach, really. And so that has limited the ability for new ideas to permeate and get ingrained within the culture. And so really that creating of a platform for what we call open innovation, where outside interests can come in and work with us. Now, we've seen during the pandemic, as Michael mentioned, there has been certainly a great contribution by healthcare providers to provide great healthcare, but there has also been a great flourishing of private sector solutions to problems. The perfect example are the vaccines that have been created. Those were created by private sector entities. But in addition to that, we've seen a tremendous flourishing of technologies that help people, whether that be at the point of care, where they can actually get information online, whether that be through things like virtual healthcare and connections to their provider, or others. We've seen a tremendous sort of creation of new ways of doing things by the private sector, and actually a willingness during the pandemic to adopt them. And so what we're trying to do is create that as being more of an ongoing normal activity, working closely with private sector and outside entities to bring new ideas to the table. That's number one. Now, I would say the second thing is there's a recognition that we need to collaborate with others in the ecosystem. It's not just the private entities. It's also other hospitals and other health systems around the world. And so we've joined a network called the ARC network, which is based out of Israel, but has centers in the UK, in the United States, in Australia, and obviously in Canada. And we are working with a network of hospitals to really push forward these ideas. And so you really can start to see improvements because you can look to what other places are doing in a much more accelerated way. And then I would say the last thing that I think is really important has been a very deliberate focus on digital innovation itself. The big advances are going to come from digital technologies. Even when we think of pharmaceutical products, and medical devices, oftentimes it's the digital innovation that's making the difference. And digital innovations, I foresee will make several advances. One of which is within the space what we call advanced decision support, where we use data to automate decisions where possible, or to provide information to humans in a way that they can make better decisions at the point of care. The second area is within this care everywhere concept, where people can get care whether they're in their own home or in a hospital, and get feedback no matter where their providers are. And we're seeing a whole bunch of new technologies there that are going to be very transformative. And then the third area is really around this equity of care, and how do we help populations of patients who are who perhaps have disadvantages in other ways, and make sure that they have equitable access to services and to care, so that they can have the same opportunity of care that others do. So those are the sort of three big areas. So again, just to summarize: open innovation concept, collaborating with other institutions in Canada and around the world, and then the third is this focus on digital innovation as the key to advancing quickly.
That's excellent. And when I speak with my clients, often we talk about the need to think beyond our local and national borders and think internationally. And I'm sure a lot of people in the community don't realize how international the reach is of the Ottawa Hospital. So that's really interesting. On the digital innovation side of things, maybe you could speak to how has the uptake been with some of the clinicians and researchers in terms of bringing in third parties and collaborating with other groups, and if you could touch on one or two projects that people may find interesting. I know we've talked a lot about activity that's going on. There's a huge portfolio, but maybe pick a couple that would be cool for the listeners to understand.
Yeah. So first of all, I'll just say that you asked about the relationship between the practitioners and private sector companies. I would say, first of all, that's actually a key success factor in our initiatives. And if we can't get a good connection between a technology company and a physician or a leader at the hospital, we will tell that company that perhaps you should go elsewhere, because it doesn't help them succeed if they can't get that personal relationship with like that champion inside. And that that is a huge benefit to the companies. I would say, like, on the provider side, on the one hand, they are tremendously, the ones when we get the connection working, I see a transformation in these people. Like, they become extremely excited. They see the potential for their input to make a difference in the world. They really, it opens their eyes to what the challenges are of bringing new technologies to market, and it gives them an inspiration factor that I think is really important, especially at this time when folks are quite struggling a little bit with the last 3 years of the pandemic. On the other hand, though, there is a little bit of at times reluctance, and I'll just say that there are different cultures. Like, healthcare tends to be quite conservative. There's high degree of risk involved, and on the flip side, tech companies tend to be quite not those things. They push hard for their products to get developed because they have to, and so sometimes that does create a bit of friction, and I think that working with folks and helping them understand where their points of friction are coming from and why, and working through them, is actually a very important part of our role in the innovation program. So I think that to your first point, there is great opportunity. The physicians and providers who work with these companies really are inspired and like it, but it is something we have to work. There are times when we have to work through. And one example, and you asked me to talk about some examples. We recently worked with a company out of southwestern Ontario that does diagnosis of COVID using a light detection on your finger, looking at the spectrum of light absorption as it passes through your body. It can detect whether there's different conditions are present, and one of which is COVID. And so we tested that technology out. It's a bit like Star Trek, where you see, you pass the tricorder, if people know that, you pass the light through the finger. It tells you whether you have a range of issues, one of which being COVID. That's a pretty exciting idea. Like, if you've been thinking about how we've had to, line up at assessment centers and even going to get blood tests, like to be able to do something like a diagnostic test in the way that I described would be a pretty massive benefit to a whole bunch of people for a bunch of things. In that particular case, like just getting to some of the challenging, yes, people are excited by it. Of course, people are nervous about its accuracy, but that's why we do the test. But just working with the company and working through, privacy issues, the regulatory side of things, so that we can help facilitate that company's ability to get Health Canada approval, because ultimately that's what will be required for it to be used in a medical context. The contract process, all the data and data management issues, working through the consent for patients. These were all issues that the company had not really been aware of, and again, we help facilitate those interactions. It is something, I think, on the side of tech companies, that I think we need to help really people understand if they're going to participate in the sector and help drive us forward. So that's one example, and I bring that up because it highlighted some of the issues of how we help the ecosystem by help coaching them through and providing guidance. A couple of others, we again, it's kind of a similar technological background, but very different use case, where we've looked at how we can help protect our healthcare workers using a technology called AIMS, Artificial Intelligent Monitoring System. It's a sensing device, computer vision, which actually can read the environment in 3 dimensions, and can, using machine learning, combined with the computer vision, can tell if people are, washing their hands or wearing PPE, and can alert the provider in a very what I would say human-centered approach, where they're nudging people towards the behavior that's desired, that's going to actually help them look after the patient better, help protect them from getting the illness, help protect them from spreading the illness within the hospital environment. And so that, those are quite exciting. We've also worked with a company to develop, and I know we'll talk a little bit more about this, is really around how we make data available. And we've been working with this Israeli company called MD Clone, which is really around how we generate something called synthetic data, which then can actually be used. Synthetic data is data that's made up data, so it is not personal health information, but it can allow people to have it. It looks like the real data, and it will behave like the real data in terms of the statistical properties. And so people can actually start using it without risking patient privacy and confidentiality, but can actually start generating insights and can use it. So that platform, and I'd like to, that platform is sort of helping inform decisions at many levels. It's not like as targeted as some of the other ones I mentioned, Aaron, but it is helping. It's kind of what I'll call a foundational system.
Yeah, and I know that's key part of the living laboratory and the work you're trying to do to spread research innovation across the hospital. So maybe just quickly double click on that one, because data and access to data is always a challenge when it comes to innovation in healthcare. So by driving that relationship and generating that synthetic data, what do you think that helps to accelerate in terms of either discovery or application of research and innovation that the hospital is generating?
Yeah, so I'll just say, from a fundamental point of view, what the biggest problem in innovation in Canada or elsewhere in the world is that we don't have data that demonstrates benefit, right? Like if it was very clear that product A had a massive impact in health or a massive reduction in cost, there would be no problem scaling that technology. So what the big problem is that we do not have good evidence as to what technologies do to improve health or reduce costs. And that is a fundamental gap in access to data. Because if we had data, we could define the benefit in terms of patient outcomes. We could define the benefit in terms of cost reduction. And so that is a fundamental issue that's a problem. It's not just in Canada, it's a global problem. Some countries are doing a little bit better. Some hospitals and institutions are doing a little bit better, but largely it has been an underlying systemic barrier to improving healthcare services. The MD Clone platform, what it does is it allows people to access data that's in the system, but as I mentioned, it's not real data. So it's not patient data. It's made up data that's made up in a way that looks exactly like the patient data. And what that will do is why is that so important is all of a sudden people can get access to this core sort of granular information that's going to then be the building blocks for understanding that value equation, that better outcomes, lower cost. And the more people who have access to that, the more people we have contributing to, first of all, better data quality. Like people are sometimes like shocked to hear that the data quality can get in the way. But the more people have access to data, the more people will have access to like understanding what the limitations of the data are and contributing to making the data better. Number two, the more people who have access to data, the more people there will be trying to describe what the problems are in healthcare, but doing so in a way that's rational and justifiable using quantifiable information. And once you have that, then you start to have people resolving towards what the big issues are, as opposed to just debating and causing more and more split. And then the third thing is, though the data start to become the source of the solution. If we're looking at like a decision tool to help inform it, like an action, if you have these characteristic, features of your illness, your age, your gender, where you live, your behaviors, that can predict whether you have a disorder, like a disease, like it can help diagnose you, it can help define the prognosis, it can help define whether you're going to respond to treatment and how much, and whether you're on better on option A or B, treatment A or treatment B. If you have all that information, now you start building technologies that actually help solve the problem for the patient. And then lastly, it helps you define whether the benefit is there. And so data plays such a foundational role. The more people we have accessing that data, the more we'll create this learning system where knowledge is created, actions are taken based on that knowledge, and then we can assess the impacts of that knowledge.
Yeah, excellent. I couldn't agree more. Access to data is really the key to driving the insights and innovations that the system needs and will benefit from. So Michael mentioned a report we're doing with OBJ and through Techopia. So we're shedding light into the broader tech ecosystem in Ottawa. Obviously, TOH and other hospitals and the innovation that's going on in health is a key aspect of that. What would you like the broader tech sector in Ottawa to hear? They've heard a lot of examples of what you're doing and you're open for innovation. So I'm sure they've heard that already. But what would you like to see maybe more of from some of the really innovative organizations we have in our local market?
Well, first of all, I'm proud of the city I live in, and I think it's tremendous because of the tech sector largely. I mean, the tech sector is a gem within Ottawa, so we do need to make sure that it thrives and continues to have opportunities. I don't think there's any risk of that not happening because of the schools we have and the environment we have and the existing companies and commitments that are already in place. So I do see that there's such a huge foundation that we're going to be continuing on in this tradition. I do think healthcare could be an opportunity for us to take our city to the next level, and I would like the companies to know that we have a platform for open innovation. I welcome the opportunity to working with them to articulate a pathway for their products to go from an idea to an early version to scaling it up beyond the Ottawa setting. I do think we have to work together to understand the different cultures and barriers, and recognize that there is an opportunity if we do work together. I think that's all I'll say on that.
Awesome. Yeah. So what I'm hearing is TOH is continues to be open for business, for innovation, and looking for collaboration and partnership in the sector. So
maybe I'll just add to that. I do think there's tremendous benefits to the companies to working with us as partners as opposed to customers, and I think that distinction needs to be made. Ultimately, there is a customer relationship that will be developed, and I don't want that to be forgotten about. But if the view of a local company is that the Ottawa Hospital has to be their customer and that's going to be it, then I think that becomes problematic for creating the relationship, because of the way in which we work and the environment in which we work, where we have procurement rules and we have challenges around how we move forward. If, however, we could be seen as a development partner, as a stepping stone to a global market, which I think is really where the money is, if you think about it. Like, Canada is a country of 40 million people. Ontario has 14 million people. We have lots of hospitals, but they're all fragmented and everyone makes their own group decision. But if you look at the world, 8 billion people, and you look at the number of hospitals in Asia and in south of the border in the US and Europe or Africa, we can make a huge impact globally. And we should be thinking about that global reach, not just the Ottawa or the even Canada markets, because really they are quite small. And the opportunities are actually smaller in Canada to have an impact, largely because we actually enjoy great health already. Mm-hmm. We have great health services. Despite the challenges we have very good health services. Think of the impact we could have in developing markets and think of the opportunities that exist there. And so I think we do have to think a bit more broadly than what's in Ottawa. And I would say that the Ottawa Hospital could serve in that as a stepping stone.
Yeah, that's fantastic. And through things like the ARC network you're a part of, you've laid that foundation already of instant access to a global innovation network. So Alan, it's always awesome to get together. We could spend hours and hours talking about this. We're lucky to have you in Ottawa in this role, driving innovation, driving improvements in healthcare, and driving better outcomes for patients in Ottawa and beyond. So I'll sum up with this. At EY, our vision is building a better working world. You've touched on a lot of things, but how would you sum up succinctly how TOH is helping to build a better working world?
Well, ultimately, we're trying to improve health. And we do that through our health services, but we have a broader view than that. And we recognize that if for people to have better health, they need to have, most of us spend the majority of our lives at work. And for work to be one in which it's safe physically, safe psychologically, is very important for both healthcare providers, but everyone in our community. And if we can work with providers or even thought leaders or technology companies that can help prioritize health, either whether that be at work or at home or doing leisure activities, or in school, those are the places where we're going to have the big impact on the wellness of our community. And again, I think a different view from healthcare, which tends to be focused on solving problems and treating disease, to one where we have maybe perhaps a broader focus looking at the health and well-being of people, is one where I think, again, where the collaboration with the tech sector could take us a long way.
I love that. Thanks so much, Alan. Back to you, Michael.
Well, gentlemen, what a great discussion. Alan, so many takeaways. I didn't really understand synthetic data. I'm starting to grasp its importance in the innovation to access the data and identify, what type of technology can have different outcomes and that type of stuff. I love your point, Alan, on how the tech sector can work with the hospital and the framework in which, or the mindset in which they should take. So very, very realistic, very forward looking discussion with both you gentlemen. Aaron, you did a great job co-hosting, all your expertise dating all the way back to Sick Kids and at EY as well. Thank you both for joining us. A great episode and a different topic. Often we're talking about companies and what they're working on, but a little bit more of a big picture view today. Thank you both for joining us today.
Good. Thanks. See you soon.
All right. What a great episode. We're keen to wrap up here. I want to recognize some of the other companies that are supporters of this Techopia project. Let's take a look at them now. Techopia is brought to you by many great sponsors, such as EY, building a better working world. Number Crunch, offering virtual CFO services for SaaS companies. Perley Robertson Hill and McDougall, a leader in business and technology sector law. TD Bank, specialized programs for technology companies. The University of Ottawa Faculty of Engineering, creating the next generation of technical talent. Calian, innovative solutions delivered with integrity. Techopia is not only a podcast. We post new articles daily at obj.ca/Techopia. And if you're on YouTube, please subscribe and click the bell icon. A big thanks to Aaron from EY and Dr. Forster from the Ottawa Hospital. It'll be fascinating to see the developments, the innovations happening right now. It'll be interesting to see the arrival of this brand new super hospital. So excited to watch this. I want to thank you for watching or listening. We hope Techopia is keeping you connected and informed. Let's keep building Ottawa's technology utopia. That's Techopia. See you soon. Bye-bye.